So Dr. Sneddon has worked for over 2 decades on topics that have advanced fish health and welfare, and used her research to drive the agenda for the improved welfare of fishes. In 2023, Dr. Sneddon was awarded the Johns Hopkins CAAT and Charles River Excellence in Refinement Award, and she's giving the Charles River Ethics and Animal Welfare Lecture at the American Association for Laboratory Animal Science meeting. Dr. Sneddon currently leads her team at the University of Gothenburg in Sweden, investigating how to improve the way we treat fishes, decapod crustaceans, and cuttlefish. So I will now turn the presentation over to you, Lynne.
Thank you very much. Big thank you to the organisers for inviting me here to speak about this very interesting topic. And so what I am going to talk about is firstly how to assess pain, and then of course we should be putting in place protocols for improving welfare, and the main ways we do that is to provide anaesthesia and analgesia, and I'm focusing of course on the laboratory zebrafish. So I'd like to start by quickly talking about how important it is to refine our experiments, specifically with alleviating pain, reducing pain so that we can improve welfare. And key to pain management is good anaesthesia and analgesia. We really need to be able to have the knowledge to employ effective means of reducing pain. And so I'm going to talk about anaesthesia, and of course we aim to ensure that the animal is unconscious and not aware of any pain or stress or fear during invasive procedures. But of course, to be able to reduce pain, we have to actually recognise it and assess it in zebrafish. So I'm going to talk about how we can do that. And finally, of course, the use of analgesia, pain-relieving drugs, is particularly important when managing pain. And I'll talk about the latest information we have on that. Now, I've written about the 3 R's, and when we have to use an animal in an experiment, there is no replacement. We can't use cells or tissues or any other means of replacing the animal. I think reduction, obviously the minimum number of animals that we need to use to meet the experimental outcomes is important, but refinement is particularly important when trying to safeguard the welfare of a whole animal. And we can think of refinement in a number of ways, and typically we refer to the husbandry and housing of the animals. Are the animals kept in good health? Will their health be monitored, and will we intervene to improve welfare before and during experiments, and of course afterwards? Are the least invasive techniques being used so that we ensure that the least amount of damage or stress or fear is applied to the animal? And finally, when procedures do affect the welfare of the animal, how can we refine this? How can we ameliorate this? And one of the ways that we can do this with invasive procedures that cause tissue damage that would give rise to pain is we use pain relieving protocols. And the 2 in bold are the ones that I'm going to talk about today, which is monitoring welfare and then putting in place a pain management strategy. Now, some of you may adopt the opinion that you don't know if fish are capable of pain perception. I have to say that my laboratory and laboratories across the world for the last 20 years have produced ample data to demonstrate that fishes are capable of experiencing pain, and that this is a very negative event for them. They self-medicate pain relief, and any changes in behaviour and physiology are reduced or even prevented by the use of pain relieving drugs. And so I feel there is ample evidence. And so for the sake of this talk, I hope you'll join me in that opinion. And if any of you want to read about this, I've written quite a few reviews, and there are of course others that have written reviews on how fishes meet the criteria for animal pain. So there is the potential to compromise the animal's welfare when we do any invasive tissue damaging procedures on them. So the first way that we manage pain in many animals, and humans of course, is we use anesthetics. We want to ensure that the animal is either sedated, sleepy, or unconscious, not awake during any harmful procedures, and that in effect means that they are free from pain, and some anesthetic drugs do act as analgesics. They have analgesic properties, and so that helps us ensure that the welfare of the animal is very good during the surgery or the procedure. And also this aids handling because, of course, these animals move around. Some of the larger fishes are very strong, but it ensures that the animal is easy to handle. You can weigh them, you can tag them, you can perform surgery. They're not moving around. They're unconscious and sedated. And so it's quite important that we understand that. And many people sort of ask, why should we use anesthesia when we're injecting zebrafish when we don't do that for mouse or rat? But you're actually removing the animal from water and it's suffocating when you're doing the injection. And so it's really important that we do apply anesthesia during any procedures that mean the animal is removed from the water, because that's compromises their welfare. Unfortunately, it's never simple. We have to take into account a variety of different factors when applying an anesthetic drug. Things like there are differences between species, age-related differences, body condition, sex differences, and so on. And so it's very important that we take into account the animal's condition. Also, we have the problem that water quality, temperature, and oxygenation can affect anesthesia. Excuse me. And so that again needs to be taken into account. And we can use anesthetics for recovery, where we do something to the zebrafish and it recovers, or we can apply overdose of anesthesia as a euthanasia method or a humane killing approach. There is some evidence for avoidance that I want to talk about, animals actually avoiding the anesthetic drugs, which some people would say shows some sort of aversion. However, today we're just concerned with one species, the zebrafish, held in pretty standard conditions. Most people keep them in comparable water quality at the same temperature, around 28 degrees Celsius, and with plenty of oxygenation. And so today we're just focusing on zebrafish, so we don't need to worry too much about species differences. Now, how do we monitor anesthesia? There are a variety of different ways of doing this. This table shows you the different stages, 1 through 4, and then the different planes of anesthesia, 1 through 3. We have normal light sedation, and then we have light anesthesia through to surgical, through to deep anesthesia to overdose. And I won't take you through all of this, but some of the things that we can look at is whether the animal's actually moving. Is it maintaining an upright position or equilibrium? And we can look at the gill ventilation rate. Whether the animal's reactive, and we typically pinch the tail of fish to see if they respond by trying to swim away. It's a reflex response. And you can record heart rate, but it requires quite complicated equipment, and look at muscle tone as well. And here's the examples of the procedures that one would choose. So really light anesthesia, we would weigh the animal, visually inspect them, non-invasive tagging, gill scraping. And then when we're doing more invasive, if you like, procedures, we have things like invasive tags, tissue removal. We want to take the animal much deeper than that because the animals will respond if they're not fully anaesthetized. And then we have recovery surgery, and when you're doing surgery you have to actually ventilate the animal. You have to have a means of applying water over the gills, and then when we take them into overdose we are obviously doing non-recovery surgery. And there are a range of anesthetics that we can consider for use. MS-222, also called Tricaine, is very popular, but there are a range of doses. And then there are side effects that need to be considered in terms of your experiment. For example, there's hypoglycemia, that's high glucose in the blood initially, and then we get these secondary responses which really indicate a stress response. So depending on what you're measuring, you need to decide, is this the best anesthetic drug? We also have benzocaine, which is very similar to MS-222, but is organics, so it's dissolved in ethanol. With MS-222, we also have to be careful because it's acidic, and we have to buffer the pH of the water. And then there's a range of other drugs which are used less in zebrafish laboratories, things like clove oil and its derivatives, eugenol, etc. Metomidate, which is actually a hypnotic, and its partner etomidate, and is not recommended for surgery or deep anesthesia because of its hypnotic properties, and it has no pain relieving properties. 2-phenoxyethanol is quite popular. Quinaldine tends to be used in marine fish species, so not very popular for zebrafish. Now, there's a wonderful review of all of these drugs by Martins and colleagues, which I highly recommend. And what you can see here, and I don't expect you to be able to read this is just the information for one drug, MS-222. So it tells us there are a range of doses that people are using and reporting on, and what kind of effect those doses have. But a variety are used in zebrafish: clove oil, lidocaine, metomidate and etomidate, propofol, the combination of propofol and lidocaine, ketamine, isoflurane, and MS-222. And this review goes through all of them, but we don't have time to do that today. However, in zebrafish, this is a review of a survey which Katie Lidster and colleagues did in 2017, and they showed that really the majority of labs across the world are using MS-222. Very few labs use any other kinds of drugs. And we redid this survey about a year or two ago and found that it's exactly the same. Around 85% of zebrafish laboratories are still using MS-222. Now, we have to think about, is it the best choice for the animal? We've got the side effects we need to consider for the experiment. And so quite a few studies looked at this a few years ago, where they basically measured avoidance to a very low dose of these drugs to see if the animal actually avoided them. And they were looking at recovery from anesthesia. And this is the results of some of these studies by Gareth Reedman and colleagues. And they tested a range of species: carp, fathead minnow, medaka, zebrafish, and rainbow trout. And they tested avoidance. I would say it's a behavioral avoidance, because they never showed whether this was stressful or whether it just tasted horrible or smelled horrible. The animals just avoided it for whatever reason. But people tend to use the word aversion, which has quite negative connotations. So this is the response to water. So none of the species avoided just normal water. However, they did avoid hydrochloric acid, which of course would be very damaging. However, the fathead minnow actually was the only species that didn't. None of them avoided ethanol. But then when we look at the other drugs, benzocaine, etomidate, and MS-222, we can see zebrafish, which we're interested in today, avoided benzocaine and MS-222. So this would suggest etomidate would be a better option. But of course, as I said before, it's a hypnotic and shouldn't be used for surgery and not for euthanasia. But you can see there are quite clear species-specific differences. And what did Gareth and his colleagues do? Well, they performed this in a laminar flow chamber. And so you'll see it at the moment. So what they're happening is the water is flowing down here, and they've added food dye to this one side. And you can see the food dye is just traveling down this one side. And that's exactly how they tested the anesthetics. They had a low dose and they placed it on one side and then recorded where the animal actually went. And you can see here, this is to the hydrochloric acid, pH of 3, which would be painful to fishes. And so this is the side with the hydrochloric acid, and this is the side with just water. And you can see the animals hardly go into that side. And that's exactly how they did this experiment. And then they looked at the time spent in the clean side in blue and the time spent in the other side in red. And you can see in clean water, they spend around 50% of their time on both sides, same with ethanol. But when you add a hydrochloric acid, they spend hardly any time on the hydrochloric acid side. The same for quinaldine. And then we've got isoeugenol, benzocaine, MS-222, 2-phenoxyethanol. down to lidocaine here. And so there's only 2 drugs here that actually the animals show no avoidance to. But just because they're avoiding it, we don't really know why, what the mechanism is. MS222 and benzocaine and isoeugenol have pain-relieving properties, as does lidocaine. So one can ask the ethical question, is it better to put the animals in something that they don't like very much, but then they have analgesia, or put them in something which is etomidate, which is just a hypnotic, which we're not sure whether the animal's truly anesthetized, with no pain-relieving properties. Yannicki Norgreen and colleagues then looked at the after effects of MS222 and in particular measured a range of different behaviours and showed that actually the behavioural responses of animals anaesthetised with MS222 are exactly the same as the controls. There's no difference in terms of recovery or in the behaviour after this. So there's no long-term effects, it would seem, from this study. Other groups, Anna Maria Valentine and colleagues, for example, have looked at combination anaesthesia. If these drugs are somehow avoided by the animals, can we use much lower doses in combination? And when you combine drugs, you can reduce the dose. This is routinely done for us humans, where you use a much lower dose, but because the 2 drugs sort of amplify their action or work synergistically, you can use a much lower dose than you would normally. So Anna Maria's group tested propofol and lidocaine versus MS222, and the graphs are a bit blurry, but I hope you can see what we have is the time to lose equilibrium. So that's when the animal can't maintain that upright position and goes into anesthesia. And what we see here is the propofol lidocaine mixes and then MS222 at the end. And you can see the animals go much quicker into that loss of equilibrium. So we assume much quicker into anesthesia than MS222. Then we can look at the response to tail pinch, which, as I said before, you pinch the tail and if the fish moves, it's still conscious. But this is a lot time to lose that response. So again, much quicker with the propofol lidocaine mix compared to MS222. And then this was a response to a painful stimulus. And again, that loss of responsiveness much quicker if you use this combination than if you use MS222. So that would suggest it's much quicker knockdown and the animal is unconscious much quicker. So just to conclude, there's lots of information out there on anesthesia and zebrafish, and many studies are starting to look at drugs other than MS222 to try and find something that's more humane and effective. And combination anesthesia is something I think we do need to investigate further, but there are a few studies, but we could do much better in terms of research. However, we also need to consider reproducibility, and that's what many researchers are quite worried about. So it's kind of a barrier to uptake. That, you know, we've always used MS222, everyone uses MS222, and I think really we need more research to try and convince researchers that there are maybe more humane anesthetics out there. But I hope I've shown you that anesthesia, it's well researched in terms of finding drugs and doses. So now I'd like to move on to actually assessing welfare in laboratory zebrafish. And many of you might work at facilities where they have hundreds, if not tens of thousands of tanks with hundreds of thousands of fishes. And these fish need a welfare check at least once a day. So when faced with this kind of huge number of tanks, it can be quite challenging. Now, it's a no-brainer for me. Why do we assess? We do it as scientists because we want to have healthy animals in our experiments so that our science is robust and that it's really valid. And of course, we don't want to be doing science on sick animals. And I believe we have an ethical and moral duty to the animals to ensure they're kept in good welfare. And so we focused quite heavily on assessing welfare in zebrafish because they are used in huge numbers. Fish are now the second most popular experimental model really in Europe and probably across the globe. And in Europe, 50% of the numbers are probably zebrafish. So we're using vast numbers of these animals in experiments, so their welfare should really be a priority. And of course, if you're doing experiments, and zebrafish are subject to invasive procedures, things from fin clipping through to spinal nerve crush, optic nerve crush, heart damage, and all of this requires surgery, which causes tissue damage. Now, that tissue damage gives rise to pain, and it could be that you're assessing pain in your experiments rather than the response to your treatment. So where it's practically possible and where there's no confounding factors using the analgesics, I think it's really important that we are trying to reduce pain in experiments as long as you're not studying pain itself. And so I want to talk about an NC3R's funded project. It's NC3R's in the UK, where we set out to assess and alleviate pain in laboratory zebrafish. We developed an automated artificial intelligence monitoring tool that could accurately gauge the welfare of the laboratory zebrafish and identify when it was in pain. And then we used that tool to test a range of drugs with analgesic properties, pain relieving drugs. And we did this via immersion. So we just dissolved the drug in the tank water because I'm sure you know zebrafish are tiny, and injecting them with analgesic is quite invasive in itself. And so what we did is we monitored zebrafish. We had control fish, which were completely undisturbed. We had sham fish, which were anaesthetized, but nothing was done to them. And then we had 3 procedures. We had fin clipping. This is where part of the tail fin is removed for genomic screening and in fin amputation studies. And that's done routinely with anesthesia, but typically analgesia is not given. We then looked at pit tagging, and here you can see the zebrafish pit tag on the photograph. It's inserted through an incision in the abdomen, so again done under anesthesia, but no analgesia is given. We looked at muscle damage to simulate surgery. Again, anesthesia was used, but no analgesia. And then we looked at a standard pain test, which is the subcutaneous injection of acetic acid into the frontal lips, which we validated for a range of species. So we wanted to compare these laboratory procedures with something we knew that was going to elicit a pain reaction. And so with my colleagues at the University of Liverpool, we developed software where we could track the behavior of the fish in 3D. So what you can see here is the top view, and the dot shows you the fish is being tracked, and the side view. And then this is a 3D diagram of the tank space where we're acquiring real-time information. And I do apologize for the quality of the videos, but we have to turn down resolution so that we can get that real-time data acquisition, so the videos don't take up much memory. And this allowed us to get this real-time behavioral information on things that we can't measure by eye. So speed of swimming, distance traveled, accelerating, decelerating, or braking, and quite a few more. And that removed human error and bias from the experiment. And so we performed these experiments, and we came up with some indicators which are fairly simple. We had healthy zebrafish are generally continuously swimming. They use all of the tank space. They swim in mid-water, very calm swimming with gentle turns. In comparison to zebrafish, which had undergone a procedure where tissue damage was caused, they are very immobile for long periods. They use the bottom of the tank mostly. We see often bursts of erratic swimming to the top, and we see unusual behaviours. Now, I hope those differences are quite clear to you, and you can actually assess these by the side of the tank. Of course, we went down a very complicated route, but I'm going to show you some videos as examples so you can put this information I've just given to you into practice. So what you can see here is a fish, and it's swimming constantly. It's in mid-water. Nice calm turn there. And it's constantly moving. Again, mid-water. So that fish is a normal, healthy, undisturbed control fish. And then we have the next example. Now the video has started. So what you can see is the fish is sitting on the bottom. not moving around very much. It's wafting its tail a lot, but not going anywhere. So an abnormal behavior. And that fish was actually fin clipped. So it was anaesthetized, part of the tail fin was removed, and its behavior was affected by that. Here's another example. So this fish sitting is in the bottom of the tank. It's swimming and then it's thinking, which is quite an unusual behavior. It's sort of bouncing on the bottom. So this fish had actually received a pit tag, which is inserted through the abdomen, again done under anesthesia, but no analgesia is given. And then this is our final example. So as you can see, the fish is swimming in mid-water, nice calm turn. Nice calm turn there, it's constantly moving. And that fish was actually fin clipped, but we put lidocaine at 5 milligrams per litre of tank water into the tank, and you could see the behaviour was much more normal. And this is the kind of data that you get from these analyses. This is tracking behaviour 2 hours after treatment. And what you can see, this is a diagram of the tank. These are control fish. And this is the movement for 25 minutes. Green dots are slow swimming, red dots are fast swimming. And the animal is using all of the space. Then we take a look here. This is a sham-handled fish. So it's been anaesthetized and handled, but nothing's been done to it. And you can see it's pretty much using all of the tank space. And then we can see the fin clip. So it's not moving very much. It's just using the bottom of the tank. This is pit tag insertion, same sort of response, not moving very much, staying in the bottom. Muscle damage, again, same response. And then this is 1% acetic acid. So we can see quite clearly the behavior has changed. We then use the tracking tool to assess a range of drugs with analgesic properties. So that again, these fish have been fin clipped, and this is 2 hours after the clip. We looked at 2 local anesthetics, which have pain relieving properties, lidocaine and bupivacaine. And you can see this fin clip fish is behaving pretty normally with 5 milligrams per litre lidocaine. However, bupivacaine at 1 milligram per litre is not very effective in preventing those behavioural changes. We looked at a non-steroidal anti-inflammatory drug, an NSAID, 2 milligrams per litre, not very effective, but 8 milligrams per litre was. Then we looked at an opioid morphine, 3 milligrams per litre, not very effective, but 48 milligrams per litre was. And so we can use that information then to inform analgesic protocols in the laboratory. Excuse me. So what we did is we put all of the data that we collected through a principal components analysis to identify the key parameters that are important for this welfare assessment. And what we found was that the animals reduced the distance they swam, they reduced their use of the space, they remained in one location, and they reduced their activity. And what we did was we used chromatic analysis, which effectively assigns a color to the data. So what you can see here is red, green, and blue. And then it takes these parameters and gives the animal's behavior a color, and we can come up with a color index. The data can be extracted in real time to provide the health status, and we've tested it just using one camera, so 2D. We tested various other treatments, and we also took it to a public aquarium to see if it worked somewhere else, and we used it in their quarantine area. So what happens is the data is given a color, and it's based on the scores for activity, location, and distance swum. And if the color is green, it means the animal is normal, so it would come up here. If it's okay, it's blue, it'll come up in this blue area. If it's unhealthy, it comes up as yellow, and abnormal comes up as pink. And the data is collected 1 minute behind. So this is the last 1 minute of behavior, the last 10, last 20. So we're going backwards in time. So we get a refresh every 1 minute. And here's just some examples to show you. This is a sham-treated fish, so anaesthetized and handled, but nothing done to it. This is before the treatment, and then 2 and 3 hours after the treatment. And the animal is coming up as healthy across the videos. Then, for example, this is a pit-tagged fish. This is before the treatment, and you can see it's coming up as healthy and then okay. And so for the last 1 minute there, the animal became quite hyperactive, and that can happen. The animal can suddenly be hyper for no reason, or it can have low activity for some reason. But this tells us that we need at least 10 minutes of assessment to get a true picture of the animal's behavior. And then at 2 hours and 3 hours afterwards, you can see the animal is coming up as unhealthy. And the idea is that alerts would be sent to the carers or researchers so that they could come and intervene and improve the welfare of the animal. And so this is it in action. We've got the tracking here, and then we've got the health index here. And this is a normal fish. We paused and we fin clipped. And what you can see, if you keep your eyes on the yellow pink part, it will refresh in a moment. So the animal is coming up as abnormal because it's been fin clipped. And so we've published this. The software is freely available. And as an idealist, I'm hoping people will use it to improve zebrafish welfare. We call it the Fish Behavior Index, and I've been testing it. I've tested it in rainbow trout, and it seems to work in rainbow trout as well. They have quite a similar behavior. We also looked at complexity of movement, and we did that by calculating the fractal dimension, and that's just a measure of how complex the swimming trajectories are of these animals. And in mammals, we find that the fractal dimension, the complexity of movement, declines with poor welfare. So what you can see is all the groups are sort of bunched together before we do anything to them. Then we assess them at 1, 2, 3, and 6 hours after treatment. And so you can see here that the controls in these white circles remain stable, as do the sham in the white squares, as do the fin clip plus lidocaine in the white triangles. And here you can see that over the experimental period, the 1% acetic acid and the pit tag fish are starting to show an upward trajectory at 6 hours, so starting to show recovery. However, the 5% acid fin clip and the 10% acetic acid are showing still a downward trend. They're not actually showing recovery at 6 hours. Now, that would lead us to decide that these were actually moderate severity procedures, and often most people say that fin clip is mild. So this would suggest, but you could use something like lidocaine and you see that there's no difference between control and sham in that case, and you could improve welfare. We then used that fractal dimension data to come up with an arbitrary pain scale, and we don't really have any pain scales for fishes. There is lots and lots of scales for mammals. And what we did is we looked at the range of fractal dimension for the control, the fin clip plus lidocaine, the sham handled, the 1% acetic acid, 5% pit tag, fin clip, and 10% acetic acid. And we arbitrarily decided this was normal behavior, that this was a stress response to handling an anesthesia, and then this was mild, moderate, and severe pain. So this gives us an idea of how bad the pain is. But of course, this needs further development. You know, there are many other procedures that are done to zebrafish in laboratories. Now, we also assessed pairs. So here we see a control pair where and the difference is they're still constantly swimming, but they do like to interact with one another. So we see them chasing after each other. However, when you fin clip one of those pairs, and the fin clip fish is on the bottom here, you can see its behavior is quite different to its partner, but it's not moving very much and it's sitting on the bottom and not interacting with the other fish. We also looked at groups. So here we have a group, and again, they're usually constantly swimming and interacting with one another. This is just normal zebrafish behavior. And then for this example, this fish has been injected with 10% acetic acid subcutaneously into the frontal lips. And rather than sitting at the bottom, it sits at the top, and 50% of that group sat at the top rather than the bottom. but because we've developed the fish behavior index to really look at use of space, then it still comes up as abnormal. And we could do some complicated tracking approaches, but unfortunately the big problem was that then we'd need to use high resolution videos and we would lose that real-time data acquisition, and so we didn't have a real-time alert system, and so we could get the data, but it would be post-processing. You would have to analyze the videos after they were taken. So to circumvent that problem, because we really need something that works in real time, my colleagues and I came up with a different approach where we took the data directly from the video frame. And what you can see is that the fish are very white against a dark background. So if you measure light saturation, the more the fish move, the more light there is. And that's a proxy for activity. We can also measure the hue vertically and horizontally. That tells you where the fish are in the tank. And we can measure clustering, so you can see how close together the fish are. And that's exactly what we did. So we had groups of 6 zebrafish. We had a control group and a sham-handled group. Then we had groups where 1, 3, or all 6 fish were clipped. And then we repeated that with lidocaine present as a pain-relieving drug. And we found that the vertical position, the height in the tank, the animals changed the height in the tank. And so this line represents the pre-treatment normal bit height in the tank. So if the value is above this, that means for the 6 hours afterwards, they were higher in the tank. And a value below this means they dropped down in the tank. And so they went lower in the tank. We also found that activity changed over time. This again is the line that signals pre-treatment activity. And so any values below this mean that after the 6 hours post-treatment, the animals were less active. So the closer you are to these two lines, the more normal your behavior was compared to pre-treatment. And we can see the controls are sitting here, the sham group is sitting here, and then we have groups where 1 fish was clipped, 3 fish were clipped, and all 6 fish were clipped. So we can see they've dropped down in the tank and they're much less active. Then we add lidocaine and we can see there is a shift towards the lines for the 1 clip fish, the 3 clip fish, but not so successful when all 6 fish are clipped. And we think that might be because there's not enough lidocaine for uptake in the water, and that's something we need to investigate. But this shows that even in groups, there is a drop in position and much less activity. So my lab and many others across the world have tested various drugs, looked at their analgesic properties, and we now have quite a number of different drugs and doses that we can use to employ in pain relief. So for example, the local anesthetic lidocaine, we've tested it at 5 milligrams per litre dissolved in the tank water for 1 individual adult. And then other groups have tested morphine. They've found that 8 milligrams per kilogram of fish injected intraperitoneally in the intraperitoneal cavity, IP, is effective. Some groups have used 2.5 to 5 milligrams per kilogram intramuscular injection, IM, and there's a range of NSAIDs that have been used as well. So there's quite a lot of information out there that we can use to actually produce pain management protocols. Of course, when we're thinking about this, perhaps, and I won't say too much because I know Will Norton's going to speak, perhaps we should be replacing the fin clip, and that's something that Ken Wintilly and Will Norton's lab has actually sought to do. And they've looked at AB zebrafish adults. They've also looked at sticklebacks, and they've done this. They catch the fish, hold it in the net, and do 3 very light strokes. And they don't use anesthesia. Well, we collaborated with them and we repeated their experiment, and we used the fish behavior index to analyze the behavior, and we also recorded water cortisol. And what I can show you is this is the fish behavior index before anything's done to the animal, and then 1 to 2, 3, and 6 hours afterwards. And what we did was we have skin swab with no lidocaine, skin swab with lidocaine, fin clip with lidocaine, and then fin clip no lidocaine. And these are the FBI scores. So I've put the color here on the side so you can relate it back to what you've just seen. So of course the fin clip is coming up as abnormal, whereas fin clip lidocaine and the skin swabs are coming up as healthy. And so it would seem a much better replacement when we look at the behavior. When we looked at water cortisol production, we showed that the clip with no lidocaine, no pain relief, actually had higher cortisol, and there was much lower cortisol in the other groups, so less stressful as well. So that would suggest that fin clip is a valid replacement. And I've often heard that from my results, from the extensive piece of work that we've done, that it's just one lab that's shown that fin clip is painful. Well, that's not true, because there are now papers showing exactly the same results from other laboratories. So the work is reproducible. I've also heard that lots of people tell me that they use very small fin clips and that doesn't result in any change in the animal's behavior. And so we've started an experiment where we're testing different sizes of fin clip. And so please take this with a pinch of salt because it's not complete. But this is the results of, well, this is a video of a 5% fin clip at 30 minutes. And what you can see is the fish is quite hyperactive. It's moving back and forth constantly. And this hyperactivity comes up as abnormal, and the fish is in the lower part of the tank. It doesn't go up to the higher part of the tank. We then look here at 60 minutes, and we're seeing similar sort of behavior, quite hyperactive, dashing around and staying in the bottom of the tank. And then if we look at 240 minutes of this fish, it's actually swimming in the top part of the tank, and the swimming does appear to be a little bit calmer than it was. So when we look at the FBI assessment, we find that the 5% fin clip comes up as abnormal for the first 2 hours because of this hyperactivity. And of course, they are also increased their use of bottom. They don't go up into the water column. At 4 hours, we find that the animal starts showing recovery. So yeah, a smaller fin clip does mean the animal will recover quicker, but it does still mean that there is potentially pain during the first few hours, and I believe we should be alleviating that. There is another example of a fish species, an tilapia, that also increases activity after tail fin clip by one of my colleagues, Jonathan Rock, and his group. So in my view, in my opinion, even 5%, so that removal of a very small portion of tail should cause pain, because we are damaging blood vessels and nerves, and I would suggest we use analgesia. And I was part of a FLASA working group where we looked at pain management in zebrafish, and that has actually been accepted, the report in laboratory animals. I had a great group of colleagues, and we recommend that pain management should be used for every invasive procedure with zebrafish to improve their welfare. So I hope I've shown you that we can refine our experiments by assessing welfare. There is many indicators that we can actually use by the tank side, or we can use more complicated software. I also hope I've shown you that it's important to implement a good anesthesia and analgesia protocol to improve the welfare of animals. It's an important refinement. And our lab is funded to look at other species and different laboratory procedures, and also explore brain activity during pain to determine if these analgesics work centrally to prevent any pain-related brain activity. I'd just like to finish by thanking funding bodies, the postdocs that worked on the experiments that you've seen today, and the students. Of course, these guys do all the backbreaking work, and my collaborators. And thank you very much for your attention. It's been a pleasure to speak to you today. Thank you.
Thank you so much, Lynne, for this very instructive presentation. I guess there are some questions from the audience, so just a reminder for the process. Either you can write your question directly in the Q&A. If you cannot access the Q&A, please write your question in the chat and it will be forwarded by the moderators. And if you want to ask your question directly live, you can also raise your hand and we will give you, we will turn on your microphone and camera for the time of the question.
Thank you from my side as well, Lynne, for this very interesting talk. I'm happy that you are doing this research in analgesia of this fish, and I hope you will pursue the issue of the lidocaine uptake in several fish. We have for now one question from the audience, and it is if there are any data on the use of cold for anesthesia and or euthanasia of zebrafish, on its efficiency, and if it is painful for the fish.
Yeah, there is quite a bit of research that shows that live chilling or cold, so you put the zebrafish into 4 degrees Celsius water, and they go into coma and eventually die. Now, there is some research which looked at the duration of that experience compared to MS-222, and also looked at the cortisol levels and sort of suggested that chilling or cooling was a much better method. But there hasn't really been an awful lot of studies on it because it's still not really a very accepted method. I know there's talk at the European level of including that as a humane method, and Sweden, where I'm based at the moment, we have to get special permission, we have to get ethics permission to use that method, but people are using it. And it's thought that, you know, you're not putting all these chemicals into the environment, and that if it's quicker and less stressful, then it's better for the fish. However, if any ice crystals come into contact with the tissues, then that would be painful for the fish. And I also, at the American Association for Laboratory Animal Science meeting last week or 2 weeks ago, heard that some people had been exploring morphology and pathology after chilling and saw that there was damage to the gills, that there was bleeding. And so I think it's something we really need to investigate. It's quite an interesting question though, but I don't think the data is there. However, I was going to get in touch with the speaker to ask them more about that. Is there some after effects of the chilling method? But it's restricted to small tropicals, obviously, because zebrafish live at 28 degrees. You wouldn't only apply it to these very small species. So that's all I know at the moment. I think there is scope to find out more about the impact on the animal from cooling.
Okay, thank you very much. I dare to have one more question with a quick answer. There are several questions now from the audience. So I just pick one out, which is if for fin clipping, would you recommend analgesia before and or after the procedure?
Yeah, I think our work's shown it takes at least 45 minutes for uptake. And so we either exposed the animals to the lidocaine and the other drugs before we actually did anything to them, or we exposed them immediately during the procedure. But then we waited an hour to do the assessment, because of course the anesthetic itself has pain relieving properties, so we wanted to wait until that was flushed out of the animal's system. But I would say you need at least 45 minutes for uptake. So I would recommend before doing anything to the animal, if possible, but definitely during the procedure. And then we left the animal for 6 hours in that water. I know Molly Millington at the Crick has been exposing the animals for an hour afterwards and finding that seems to improve welfare.
Thank you for your answer, Lynne. Maybe we can allow one last question. Now there are many in the chat, and I think it's very interesting to have your feedback on that, Lynne.
Okay, so there's one about the data presented from your fish behavior index. This data is mostly from adult zebrafish. Do you have any data on 5 to 10 day post-fertilization zebrafish?
Yeah, so we've used less than 5-day-old zebrafish in a quite large scale experiment where we were looking at their behavior in 25 wild plates, and we developed another monitoring software that could determine their behavior automatically. And we found that these less than 5 days, so around 4-day-old fish, were responding in the same way as the adults when we exposed them to painful stimuli. They were reducing their activity quite dramatically. And when we gave them pain relieving drugs, their activity went back to normal. So that prevented that noxious or pain-related change. So I think nociceptors develop around 2 days old, and so it's highly likely that these animals are experiencing some form of pain even at that very early age.